Hey, it's Dr. Hannah with this week's hot topic. Today I want to talk to you about tinnitus. Now, if you don't know what tinnitus is, it's this really annoying either high-pitched or low-pitched ringing or buzzing in your ear. Most people, it's a higher pitch. It can be very dull, quiet, or it can be really super loud depending on the scenario, what's causing it, the setting, those type of things. Tinnitus is actually really common. Most people just kind of deal with it. But today's video, I'm going to give you 6 ways to hopefully help you deal with your tinnitus if you have it, that either can hopefully help you get rid of it or can just manage some of that tinnitus symptoms. So first thing is, if your tinnitus is due to hearing loss, hearing aids is going to be something that is going to help get rid of or help your tinnitus. So basically how it works is, if you have hearing loss, your brain actually takes that noise perception and interprets it slightly different. So that's why you have the frequency and all that. So it kind of changes the signal, and that's why you get tinnitus. So if you have hearing loss and tinnitus is a side effect, by having those hearing aids, it's going to take that away because it's going to allow your brain to naturally process sound coming into your ear and into the brain. So that is one way that can get rid of your tinnitus if your tinnitus is due to hearing loss. The second thing, and this is probably the most common thing that people will do, is just use a sound masking or a white noise device. So what this is they'll just do low, quiet noise that's in the background, whether it's music or just kind of like that TV scratching sound. So that's white noise. It's just something that's going to mask the perception of the tinnitus, so it's not so bad. So that's a super common way that most people kind of, quote, get rid of their tinnitus. They don't really get rid of it, but they just kind of cover up that really annoying sound. The third way is behavioral therapy. So now this is more based off of accepting that tinnitus and learning to live with it as part of your just who you are, rather than trying to get away with it. Really, it's just trying to improve the quality of your life and prevent your tinnitus from driving you crazy. So that's basically what behavior therapy is going to do. The other thing with that for behavior therapy is, most people who have tinnitus, they usually have a lot of emotional stress in their life. So it's depression, anxiety, insomnia. So those are usually very similar symptoms that people have with tinnitus. So that's also something that the behavioral therapy kind of works on as well. So that's why that behavioral therapy works really well for tinnitus. The fourth thing is treating any dysfunction or obstruction that you might have that's causing that tinnitus. A big one that a lot of people don't realize is your TMJ, which is your jaw joint that connects with your neck. That can be out, and if it's putting enough pressure on various different parts of either the neck, the jaw, on your ear canal, that can cause a lot of ringing. So getting your jaw adjusted, or splints, being in braces, those things that can help, especially if it's caused by your TMJ, or if you have a lot of earwax. So sometimes if your earwax is compacted in there, again, you don't want to use Q-tips and just jab it in there. You can go to an ENT if it's really super bad to get all that wax out. You can use ear candling. Those are different ways that you can get some of that compacted wax out of your ear. You can do, melting with different oils and things like that. That's a whole other video that I will talk about next week. So that's one of the things that also can help your ringing in your ears if it's due to an obstruction in your ear. The fifth thing that you can do is exercise. So exercise seems to be one of those things that's kind of coming up in a lot of our videos that actually can help your health. So exercise is just really good for everything in general, but exercise also will help alleviate that tinnitus, because again, going back to if the tinnitus is caused by stress, depression, anxiety, lack of sleep, all those things, exercise will help with those. So naturally it's a side effect that it will help with the tinnitus. And the last thing goes kind of with the behavioral therapy is just meditate. So if you kind of go in a quiet room, I know that you have tinnitus and you hear the ringing in your ears and it's super annoying, but if you meditate and think of other things, that tinnitus potentially could go away, or it's just going to become a little bit easier. So those are 6 things that you can try if you have tinnitus or ringing in your ears that hopefully can help you either get rid of the symptoms or just deal with the symptoms a little bit better than just that really high-pitched annoying sound in your ear. That's all I have for you guys this week. We'll see you guys next time.